Okay, guys, welcome to Prescribe Orally with your host, Chris.
aka Happy Feet, and Shatner. And Shatner. Today we're going to be discussing about... What are we discussing about, Chris?
The early pregnancy disorders.
Okay, so we're going to be discussing about early pregnancy disorders.
More specifically, we're going through ectopics and miscarriages.
Because there are 4 main causes of bleeding and pain in early pregnancy, and 2 of them are ectopic and miscarriage, whereas the other 2 are molar pregnancy or
gynae
problems.
Yeah.
So our main focus today is ectopic and miscarriage.
Yeah.
We've said that 3 times now.
Yeah.
So kick back and relax and enjoy this podcast and
listen to our soothing voices.
Soothing voice on early pregnancy disorders.
We could start an ASMR channel as well, actually.
Sounds like a plan, bro.
With an Irish accent, you know.
They love it. So, Chris, will we start with miscarriages? What is a miscarriage, Chris?
So, this is when, unfortunately, a fetus has died or is delivered dead before 24 weeks gestation.
Mm-hmm.
But the majority of these miscarriages do happen before the 12 weeks. And 15% of clinically recognized pregnancies are spontaneously miscarriage.
15%?
Yeah.
You know, that's
quite a significant amount.
Quite a significant amount.
That's like 15 out of 100.
Yeah.
Whoa.
So I just want to know, like, it's always before 24 weeks?
Yes.
Okay.
So at the point of sort of viability outside of the womb.
Okay. So like after 24 weeks it's more viable? Is that
I would say so, or that would be like a spontaneous loss.
Loss.
And at that point, I don't know many... Like, if you're getting to 24 weeks, I don't know many sort of situations where it would just be a miscarriage.
Okay.
There's going to be more fetal distress and things like that coming into play.
So that's a key thing to remember. 24 weeks before gestation. No.
24 weeks gestation.
24 weeks gestation. Okay. Sort of investigations we're looking at, like most of your gynae-related problems, transvaginal ultrasound is always the first line diagnostic investigation.
When in doubt, TVUS. Exactly.
TVUS is like the best invented for gynae.
For medical students learning gynae.
For gynae. Anything, TVUS. Don't quote us on it if you get it wrong in the exam, but yeah.
That's typically what I do for questions.
Yeah.
So,
pretty much an ultrasound shows if a fetus in the uterus is viable.
So can detect the sort of fetal products.
Retained products.
Heartbeats and things like that.
And you can also do a blood test, so in which the HCG in the blood normally increase by above 63% in the 48 hours. It's a lot of numbers to remember. Just remember HCG levels in the blood just increases.
They increase significantly when there is a viable intrauterine pregnancy.
If there's
we'll come to this with ectopics. There'll be a decrease, but that's for later on.
7 types of miscarriages. So wanna go through them, Chris? So you say what the 7 types are.
I'm gonna get the list right in front of my face. Editor.
Get it up.
Get it up. So first we have complete, incomplete, inevitable, threatened, delayed, early fetal demise, and septic.
Okay, so that's quite a lot.
There is a lot to remember.
There's a lot to remember. Yeah. So so we'll go through each of them. What is a delayed miscarriage?
So this is where a baby has died by or has not physically been miscarried. So there's a dead fetus within the uterus, but has not been physically miscarried yet, has not left the uterus at that stage. And then if there's a suspicion of this, you would technically have a gestational sac of less than 25 millimeters and it would be empty. So to confirm delayed miscarriage, you would then have gestational sac that is more than 25 millimeters and would be empty. And there's also no evidence of a heartbeat or cardiac activity.
Okay, so we were talking about delayed or missed miscarriage, which is what Chris said. The cervical os is closed. Did you mention that? Yeah.
No.
So
Isn't even paying attention to our own podcast. Incredible, guys.
sorry, I was searching up because like it's such a hard concept to grasp. So like
A lot of sort of criteria to meet for each different
miscarriage
miscarriage.
is thingy. So one of the biggest things we remember is MTC, which is like my tiny car
Yeah.
is closed.
Yeah. So MTC is closed, meaning your missed miscarriages.
Yeah.
Your threatened miscarriages
Yeah.
and your complete miscarriages all have a cervical Oz that is closed. And I think this sort of makes sense logically in your head. You know, if you have a car, you're going to keep that closed so no one steals it. So my tiny car is closed.
Yeah. No, that's my tiny car is closed.
Yeah.
You know, that's really good.
Yeah, I'm impressed with our mnemonics.
Our mnemonics are top notch.
Unreal.
So let's move on to threatened.
Right. Threatened miscarriage. What
Yeah.
symptoms are you getting?
So with
bad boy.
With threatened, there's sort of, correct me if I'm wrong, there's sort of like vaginal bleeding.
Yep.
Yeah. And it's usually light spotting or sort of like a gushing with clots
Mm-hmm.
and mild period type pain. Those are the main symptoms. You're bleeding.
Presenting is your bleeding, spotting, or gushing with clots, and your mild period type pain. So then you need to also think about the sort of cervix and the uterus's status at that time. So as we've said, my tiny car is closed, so therefore cervix is closed.
Yeah.
And you would also have a uterus that is of normal size and shape due to its gestation.
Yeah.
It's not going to be abnormally big or small.
And the ultrasound will show detect a heartbeat in a threatened miscarriage.
Mm.
But one thing to remember, I don't know whether we touched on the delayed miscarriage, where the symptoms where there is no bleeding,
Mm-hmm.
you know, none or small amount of bleeding compared to the threatened.
Mm-hmm.
And complete, my tiny car is closed for business, so complete is also a closed problem. The cervix is closed, and there is decreased bleeding.
Yep, that makes sense.
That makes sense, yeah.
Like at this point, it's a complete miscarriage. Therefore, there's no longer any fetal products within the uterus.
Nothing in the uterus, so there'd be like, that's true.
It's you know, if you think logically, complete means that it's finished.
It's finished.
The miscarriage has finished and is done through. At this point, your main sort of concern is counselling the patient at this stage.
Because it can be traumatic, you know, carrying a child and not
even at this sort of early stage, it's still
it's
still not an easy thing. And we've sat in these clinics, you know, these early pregnancy problem clinics, and it is hard for the patients to go through. So, you know, be mindful of that whenever you're sitting in clinics, and you know, it's always good to learn as a medical student, but always remember on the other side, it's a person, it's a human being as well. Yeah, you're not just learning about theory.
You're not. Yeah.
So, on that happy note.
Let's move on to inevitable miscarriage, which is heavier bleeding. Because I
like to think of inevitable as the fetal products are going to be passed, and for that to happen, your cervical Oz needs to be open.
Yeah.
You know, they're going to leave the body and quite quickly. And quite soon.
So
and along with that, it doesn't sound like a pleasant experience. So try and think of it with the heavier bleeding and quite a lot of severe abdominal pain as well.
Yeah. So the cervical Oz is open in this one.
Mm-hmm. Yep.
So just remember that, like, if cervical Oz is open and lower abdominal pain, heavy bleeding, it's more than likely inevitable miscarriage.
So then, moving on to your septic miscarriages.
Okay.
This is quite sort of common sense. You know, sepsis is a procedure of you being ill. You'd have chills, high temperature.
Fever. Yeah.
Everyone knows their sepsis 6. So septic miscarriage is when the patient has your septic-like symptoms and they are miscarrying.
Yeah.
And one thing, I'm not sure how to remember this myself, but it is the cervical os is open, and the uterus is tender. But I guess if you're sick with this sort of septic miscarriage, you are going to be quite tender and sore and ill.
Most of the questions we came across is like it's always to do with the cervix open or closed. So you can kind of narrow it down to 3 for each.
If you remember which ones are closed, then the rest of it kind of comes with it. So yes, cervical os is open for septic, and so incomplete is similar to inevitable with the very heavy bleeding and severe abdominal pain. Cervical os is open, but the uterus is, however, smaller than the date expected. Okay.
And the ultrasound shows retained products. So the incomplete miscarriage involves there's like products in there, whereas inevitable. Does inevitable have products?
Yeah, inevitable have products, but it's just the cervical os is open.
Cervical os is open, yeah. So there's retained products which can't leave, which is incomplete miscarriage, and that needs some sort of
Okay, that makes sense in my head.
Yeah, that's trying to make sense in my head. So it's something anyway. And you're missed.
So missed is you would be the patients basically can be asymptomatic, which comes in the name, missed miscarriage. It hasn't been spotted because there's been no symptoms to sort of make the patient even think about it. In this situation, remember, my tiny car is closed, so the cervix is closed and the uterus is smaller than expected, and then you would have no fetal heartbeat, and your main sort of your gestational sac diameter is also more than 25 millimeters.
Pull. So what's the difference between delayed and missed? Are they not sort of similar?
Let me think.
Because
they both have no fetal heartbeat.
Yeah.
I guess it says delayed. Delayed is this is where the baby has died, and there hasn't been a physical miscarriage yet. Whereas missed, I think, is just there hasn't actually been sort of a viable pregnancy in the first place.
Okay.
Whereas with delayed,
the baby has actually died.
Yeah, there is death in the delayed one, but with missed, I think there must be something wrong in sort of the development of the fetus.
Oh, okay.
We could look
it up. Consultant Papa Google for some options.
Sure, so, we're trying to learn this as well as you guys. So
so kick back and enjoy.
This isn't us teaching per se.
During this time, we would like to talk about our sponsor, which we have none. So subscribe and like this video if you're watching on YouTube. If you're not, I don't know, share with your friends of this podcast, which would be cool. Yeah.
Okay. Well, nice. Nice says that a missed miscarriage is also known as a delayed miscarriage.
So completely forgot we ever said about delayed miscarriage. Just go with the missed miscarriage part. Yeah.
No way. Why is?
It happens. So yeah, my tiny car is closed for business, in which the cervical os is open for missed, threatened, and close, complete. Yeah. Sorry, not closed. Complete miscarriage. Yeah. Okay. So that's
going through our types now. Yeah. We need to go into sort of our management.
Management is what.
So what, standard management sort of rules is you either have your sort of non-pharmacological natural way of dealing with things. You have your medical management and you have your surgical management. So obviously we need to work out when to use each of these, and there are certain criteria that you need to know to determine this, and this will come up a lot in your questions of we have these situations, what medical management or what management are you using for this miscarriage? So what do you need to consider, Shatner?
For for the medical management.
Just in general, like what do you need to think of? So
well, you need to think of like if you being realistic, think about whether it's actually the bleeding is actually because of a miscarriage or like something like a gynae related problem. So like the cervix.
Yeah.
And you also need to look at the uterine size.
Mm-hmm.
See,
I guess that kind of tells you what type of miscarriage you're dealing with as well.
It does if you remember all those, but like
I do.
You do?
Yeah.
Okay, so what's the uterine size for a threatened miscarriage?
It's normal.
Okay, that's actually pretty good. Did you know that?
Missed is smaller.
Missed it smaller. Okay. I got how you figure that out. That's all right. You had like some smart brains going on there, but yeah,
I do. Like, I just think of it logically. Which ones are the ones that seem to just like the pregnancy isn't growing? Which ones do you think of that sort of the fetus inside isn't growing properly, and that's why the uterus is going to be smaller? So you're missed, you're delayed. If that's a separate one, we need to work that out in our heads.
Yeah, missed. Oh, the fetus isn't proper.
So like you're complete, incomplete, and threatened, I think, are all normal. Or abnormally large. So I think maybe incomplete is abnormally large because you've retained products.
I actually don't know. No,
does it say?
Yours is smaller than the date expected.
Jeez. Okay. Well,
pretty much nearly all of them is smaller. And it's only threatened and inevitable that it's normal size.
Oh.
No, it's just that's mad. Cool to know. So the sort of management.
I got distracted.
Sorry.
You tried to test me. It's your fault.
It is my fault.
Yeah, it's your fault. So
like,
sorry. Back to sort of what aspects you need to consider with dealing with these pregnancies. So uterus size.
Yeah.
Where the bleeding's come from.
Yeah.
And also rhesus, negative or positive.
Why is that?
Well, because you need to make... So, say, for example, we're doing a surgical management. There's going to be a chance that the mother's immune system is going to come across the sort of fetus's products.
Yeah.
And if there's a mismatch between the mother being rhesus negative and the baby being rhesus positive, then in the future pregnancies, there's going to be your sort of rhesus sort of problems coming up. So, mother's immune system for the next baby will be trying to get rid of it.
Okay.
So that's why you give your anti-D. So therefore the mother's immune system doesn't actually attack the next child along. It's not really to save this sort of pregnancy, it's to save the
next one. Okay.
Yeah. Or if there is if the mother wants to have a next one, then that means,
okay,
you're not sort of, you haven't tied one hand behind your back in the next year or two,
Okay, cool. That's good to know, obviously. Just, going back to A-level biology, that was an A-level stuff, yeah. So
it's like 20 years ago for you.
20 years ago for me, personally. So expectant management is one of the
just letting it sort of
one of the managements, isn't it?
Yeah, it's just letting it take its course. That's your sort of non-pharmacological.
So letting the miscarriage happen by itself.
Yeah.
Okay. And it's what type of miscarriage is it effective for?
I think you're incomplete and you're threatened, I would say.
Okay.
You're more like, because threatened is it's gonna happen and you're incomplete. You've already sort of started to lose those fetal products.
Incomplete is the retained products.
Yeah. So
it needs to come.
The mother
come
still can get rid of the rest.
Yeah.
Basically.
Okay. But not for missed miscarriage, because it's asymptomatic.
Yeah, it's asymptomatic. So really, there hasn't been.
Yeah. And what sort of medical management options are available for?
So there's 2 medications used, which both luckily begin with M.
Wow. So we love that.
I'm not going to look at our notes for this one. So misoprostol,
which is
prostaglandin.
Yep. So prostaglandin. Yeah. So
I didn't even think about that, but I knew it anyway.
Yeah, of course.
You're frankly a genius.
Yeah, genius.
And then mifepristone as well, which is anti-progesterone.
You totally did not remember that. You read that off the screen.
What?
So it's an anti-progestrogen. progesterone.
Progesterone.
I don't know whether I'm not going to remember that, but mifepristone.
My wifey Pristone.
No, that does not work. So
I just remember the two M's.
Okay,
you know.
two M's. That's a medical.
I think once you read it enough times, it kind of sticks in your head. Like I knew it was mifepristone and misoprostol.
Yeah,
I haven't specifically tried to learn it. It's just after being obs and gynae for 5 weeks, it kind of sticks in your head.
Okay. So first line recommendation is what by NICE guidelines. So like, if you think about it, you know, what are you trying to suppress?
You're trying to suppress the sort of inflammatory response, aren't you? So
yeah,
like you're trying to cause an inflammatory response to get rid of it.
Yeah.
So you want to do your misoprostol then?
Yeah, that's right. So there is
common sense prevails.
You can use vaginal misoprostol, or
okay.
If the patient wants oral.
Oh, okay.
If they prefer oral.
If they prefer it, you
yeah.
can. Oh, okay. Fair enough.
So the addition of oral mifepristone is not currently recommended by NICE. Whereas in the US it is.
Yeah, so you US subscribers and followers, remember it's slightly different for you guys.
Slightly different for you guys. Than
That's
NICE.
nuts. I hope we do get some US people following us. You know.
So the surgical management option is usually if there's a heavy persistent bleeding for more than 2 weeks, or it's the patient's choice.
Yeah.
And suction. Yeah.
Okay. So
suction evacuation is usually under general anesthetic.
It's surgical procedures.
It's a surgical procedure. Yeah.
I'd assume that, to be completely fair.
So surgical management is also used for certain miscarriages if there's more complications involved, you know. But yeah.
Okay. Alrighty.
So
what situation is better, medically or surgically? So if there's sepsis, I'm going to assume
medical.
Yeah.
Just
increased risk of hemorrhage, I'm going to assume, is medical as well.
Increased risk of hemorrhage is, yeah.
And then gosh. Let's see. I actually think it's when there's sepsis, hemorrhage, or if there's previous stillbirths or miscarriages, then you choose, then you would prefer medical over surgical. Yeah. But again, you know, that's up to the doctor to kind of communicate to the patient. The patient still has that choice.
Yeah.
So that's miscarriages, isn't it?
Yeah. So to summarize miscarriages.
Oh, jeez. Okay.
Again, just get this into your head. Yeah. My tiny car is closed.
Yep. So it's your missed, threatened, and complete. All closed. Everything else is open cervical loss.
Open cervical loss, yeah. So and for medical management, it's usually misoprostol that's used. And
mifepristone would be another option.
Yeah, another option after. Yeah, I think that's
the gist of what
that's
you
the gist
need
of
to know.
miscarriages.
Yeah, like as long as you know that there's those 3 types of managements. One of them is just let it happen naturally. Second one's medical with those 2 medications, and the third one is, you know, your surgical sort of evacs and things like that, which use general anesthetic.
Yeah. So that we did say we are going to do a ectopic, but the time has run on. We'll cover ectopic in the next.
We'll do another episode, won't we?
Another episode, yeah. So yeah.
Thank you very much, guys.
Thank you very much for listening.
And join us for the next one where we chat rubbish and try and learn these topics.
Which is
and you can just join us for this ride, this wild ride.
Just put on your headphones. You know, like you might be driving.
Yeah. You could be sleeping. I hope not, because, you know, I don't think we're the most relaxing people to listen to while you're sleeping.
Do you know what? If they're sleeping and they have fuss in their ears, like they're learning by osmosis, which is always good.
They'll have nightmares as well.
Yeah. But yeah, for all those subscribers, we love you. Stay true to yourself.
Goodbye.
And that's us. Peace.